Hello again and welcome back to our talk today. We're discussing anti-aging research. We're also looking at skin conditions. Dr. James Meschino is joining me. Let's go now to you, Rose, on line 2. Hi, Rose, you're on the line.
Hi, Christine. Great show as usual.
Thank you, Rose.
I would like to ask Dr. Meschino something regarding arnica. My son had surgery about 2 weeks ago, and there was a scar on his face, and I've heard that arnica cream and or pellets were great for pain and or scar removal. I wonder what his opinion is on this.
Dr. Meschino.
Yeah, I totally agree that using arnica will help the scar heal faster. There'll be less inflammation, and I would encourage you to definitely use it.
Okay, well.
As well as, you know, that encapsulated hyaluronic acid that I spoke about earlier, that HA. If you put the HA serum on a surgical wound as it's healing, it'll heal faster and more complete with less likelihood of scar tissue forming on the lesion.
Interesting.
Yeah.
Now, I'm going to throw something out here that I've heard in the past, because what you said here reminds me of it. Honey. Now, this is years ago that stuck in my mind, that a study was done that if somebody got a cut or a burn or something and they put honey on it, that it actually heals the wound better and leaves less scars. Have you in your research heard anything of the sort in regards to honey?
I haven't, but I'm not an authority on honey and royal jelly, and I've looked at.
Cass is a specialist on that.
Yeah, I read his book on royal jelly, and there's a lot of stuff there, and so he has more experience with that than I do.
Yes.
I haven't seen that in any peer-reviewed literature that I could comment on, so I'll have to defer to my good colleague, Dr. Kath Ingram.
Let's go now to Tanya on line 8. Hi, Tanya, you're on the line.
Hi, I just had a question. I tuned in just a while ago, and I wasn't quite clear as to what psoriasis is, and if there's a case where it's on the skull as well. I've seen a lot of shampoos that say that treat psoriasis. I'm not sure if it's the same thing or what exactly it is.
I'm glad you asked that, because I've seen people actually confuse psoriasis even with eczema and other skin conditions.
Yeah, eczema and psoriasis are different.
Two different
you know,
things.
Eczema is usually itchy and atopic, sometimes related to food allergies or inhalant things or contact dermatitis. You're touching things and you have a reaction, and that's a much more prevalent type of skin condition. Whereas psoriasis usually has, a redness and a silver scaliness to it. About 1 to 2% of the population are affected, and it can affect the scalp. And so there are some special shampoos for those people to try to slow down the rate at which those cells are dividing. Because the problem in psoriasis is that the rate of cell division is just at superluminal speed, and trying to figure out why is it doing this. And different scientists have different views as to why it's occurring. And no one's really nailed down exactly what's going on in there. And so that's an area of research that's ongoing. That's why eczema is easier to manage at this point. We have a better understanding of it.
Yes, thanks for calling in, Tanya. Let's go now to Erna on line 7. Hi, Erna, you're on the line.
Hello, Christine.
Hi, Erna.
I have a question about HGH, human growth hormone. I have been taking it for a few years, and I find it really, I look young for my age. So I'm wondering what the doctor thinks about that.
Well, I will tell you, is the HGH being injected into you with a needle?
No, just by orally.
So you're not taking HGH, you're using what's called a growth hormone secretagogue. Is that right? You're taking a number of capsules every night before you go to bed?
Yeah, that's right.
Okay, so you've discovered something that's quite magnificent, and I talk about it in one of the steps in my book as an anti-aging intervention, whereby the growth hormone that helps us grow when we're younger and stay young and vital, as we get older, it drops off dramatically. After age 50, the decline is incredible. And when your growth hormone levels drop down, your skin ages, your muscles atrophy, you lose calcium from bone, your immune system's not as strong. And so you say, well, I guess, there's nothing I could do to bring my growth hormone back. But we do know now from the work of Cyril Bowers, who started this work back in the 1960s, that if you were to use as a supplement a certain sequence of amino acids with glycine and arginine and lysine and several others, leucine, at a specific dosage, if you take them all together, and you can put them all into a few capsules actually, and swallow them, or you can get an effervescent tablet that has them in there, and you swallow it, it can stimulate your body's own pituitary gland to squeeze out more growth hormone. We thought the body stopped making growth hormone at optimal levels. What happens is it's there, it just won't squeeze it out. So this particular sequence of amino acids, it gets the brain to squeeze out more growth hormone, and it brings your growth hormone levels back up, which have an effect on your skin, on your muscles, on your bones, on your immune system, on your eyes, on your hair, on your nails. And people say, well, I'm looking and feeling younger. Is there a downside? We spoke about the risk-to-benefit ratio, and that's what she's asking.
Yeah.
Is there a risk to this? The problem is that it's not a problem. It has to be analyzed further, and that is that growth hormone makes everything grow, and that's how you matured. As when you were in your teens, you had higher growth levels. If you had a cancer that was lying there dormant, let's say you have a few cancer cells in the breast that are just lying there not doing anything, in the prostate gland, in the colon, and all of a sudden you expose them to higher levels of growth hormone, are they likely to start growing and developing and metastasizing through your body? We don't know the answer. But the biological plausibility says that has to be factored in. So you say, is there any evidence where people took growth hormone injections to grow and they have a higher incidence of cancer? Yes. In certain dwarfs who don't have growth hormone, all of a sudden their children, they don't grow. If you inject them with growth hormone, they will grow. So you say, well, in those individuals who were given the growth hormone versus the group that didn't, they just stayed at the height that they were at, does this group have a higher likelihood of developing any cancer than this group? What's the answer? The answer is yes. They have a higher incidence of colon cancer, we think, from the growth hormone injection. But they were given injections of the growth hormone, not using their body's own natural hormone. So the thinking is that those growth hormone secretagogues that she's taking are probably safe to do after the age of 50 or even 45 to help keep your body functioning at a more optimal level, provided you go for mammographies or sonography of the breast and you look at your PSA for prostate and you have colonoscopies done regularly. I think it's not a bad idea.
Now, Dr. Meschino, you talked as well when it comes to anti-aging about antioxidants and what a benefit they are. Obviously, there are certain foods that are very rich in antioxidants. After the break, I want to discuss some of these to give people a guideline when it comes to diet. And also the role of the essential fats that you also mentioned, and oils that you mentioned in your book. And interestingly enough, you talk about certain oils to avoid. So we'll address that after this break. Stay tuned.